We are continuing our discussion on the coronavirus or COVID-19 pandemic, and with new case numbers on the rise throughout the country and beginning to decline slightly here in Florida, where we recently entered phase 3 of reopening, this leaves a lot of residents questioning what we should do next. Face masks are required throughout many Central Florida communities, and more testing sites are opening to accommodate the numbers. So, what does all of this mean for you? Well, on this special edition of Healthy Connections, we're going to get an up-to-date look at where we are as a community dealing with this pandemic. Let's get an update from one of our local medical professionals. Joining me is Dr. Thomas Prince, Medical Director with the Florida Department of Health in Orange County. Dr. Prince, thanks for being with us today.
Thank you, Clarence. Thank you for having me.
Let's talk about the coronavirus numbers here in Orange County. How are we doing? Are we going up, staying steady? What do they look like?
Oh, goodness. Well, I haven't looked at today's numbers or even the numbers this last week. I can tell you the general trend is we've remained about the same percent positive, which is about 4 or 5% positive. And we haven't gone up significantly, quite frankly, which is kind of a surprise considering what's been going on with the opening of the schools and the reopening of the economy. But it looks like we're staying fairly steady for the most part.
And as you mentioned, the governor is taking us into phase 3 of the reopening here in Florida. What are your thoughts about that?
Oh my goodness, that's an interesting question. I try and avoid politics as much as possible, but I'm relatively conservative. I like to reduce risk as much as we can. On the other hand, the problem that we have with dealing with the public is always the same. Even if it seems like even if we put restrictions on people, they continue to violate them all the time. So, it's a rock and a hard place. I'm so glad I'm not having to lead this group over this whole thing. It's difficult, I think. So, obviously we want to have an economy that's functioning, and at the same time we want to have a safe environment for the people of Orange County and the people who visit us here. So it's a very delicate balance, I would think.
And along with the safety precautions that we should all be adhering to, one of the most important components also is contact tracing. And we know as of today with the President of the United States dealing with a COVID diagnosis, that contact tracing is going to be very important in that case, but it is in every case of the COVID-19 pandemic. So how important is that to really helping us get in front of this virus?
That's a good question. The truth is, in classic epidemiology, which is a study of large pandemics and so forth, the disease in populations, we have adhered to the idea that if we can catch people who are sick and segregate them from the normal population and allow them to get healthy before they're moved back into the normal population, we can help the normal population to avoid disease and all the things that come from it, of course. So the idea of contact tracing, where we might be able to track down the source of the infection, the first person who maybe brought that into the area or into the unit of people that we're talking about. For example, in the schools, we might want to see if we have somebody who's sick there. We might want to try and find out where that came from. It really is a classic technique that's been used in epidemiology, the study of disease, and for a long time, and will continue to be so because it works. So yeah, it's a very essential thing that we do.
And you mentioned schools back in session. Is there still a risk that we have with multi-generational transmission of the virus as it relates to vulnerable populations that are not going out, but they have family members who are?
Well, we spoke about this a little bit the last time, and I fully agree with you. The one of the risks of schools is that the children, of course, statistically, the children are going to do better than the adults will with this disease. So the idea of letting them to go to school for the sake of themselves is a little less disconcerting than it would be, for example, for congregations of older people. That's not to say children can't get sick, but that's to say that on a relative basis, they get sick less often or less frequently, and usually with less severe disease. There are exceptions, of course. But as you point out, one of the big concerns is, of course, if a child goes to school and is affected, gets contacted, catches a disease, they potentially could bring it home to grandfather or grandmother or a great aunt. And that's the whole concept of a multi-generational home, is where you have many generations of families living together instead of what some people think of as the kind of the nuclear home where you have just the mother and the father and the children living together. We have more and more in the United States the development and of the multi-generational home, and it is a concern. It is a concern because these older people are more vulnerable to disease. And if the child brings it home and grandmother gets the disease, she has her blood pressure and she has her diabetes and she's overweight a bit, and next thing you know, we have a very sick individual. So we need to take precautions. If a parent or a family choose to send their child to school, they need to segregate perhaps the older portion of their household from where the younger portion is. It's a concern. I don't have all the answers for that, though.
And Dr. Prince, from your point of view, what are the components that need to be in place for us to finally get in front of this virus and start to see the numbers going down universally? I mean, the utopian ideal scenario, what would that look like for you?
Well, it's funny that you ask that because I keep looking at the literature to see what everybody else is doing, see what else is going on in the world, and it's interesting. We look and see, for example, in Sweden, where they've allowed the infection to go unchecked, and they actually have done fairly well. But that's a different population than what we have here in the United States. They have different medical propensities towards disease. They have different social behaviors. They're a homogeneous group. They tend to have similar belief systems so that they can be more easily controlled as a group. And I don't mean that in a bad way of control, but I mean in control in terms of being able to take care of the business in an appropriate fashion. We're a little less disciplined here in the United States, perhaps because we're so multicultural. And multicultural is a wonderful thing, but in terms of being able to all agree immediately and quickly, that makes it a little bit more difficult. You look at a place like China, for example, which we understand has a rather firm, and I guess some people will use totalitarian, I don't know if that's the right term, but what I mean to say, a very disciplined form of government, and where there are significant restrictions on personal freedoms to make choices like we have here in the United States, and yet they haven't been able to control this entirely. So the idea that we are necessarily going to control this, it doesn't make a whole lot of sense in terms of social structure or social behavior. I think our best chance of control comes from the possibility of a vaccine or a number of vaccines that may be effective at giving what's referred to as herd immunity, or making sure that enough people are immune to this disease that they can't pass it along. I think that's the most probable way we're going to get rid of things. I would have loved the idea of having everybody just spend 6 weeks at home and then suddenly it's gone. But they almost did. New Zealand had something like that. They basically shut down the entire society for a period of time, and they rid the country of disease. And yet a few weeks later, they suddenly have an outbreak again, and they don't even know where that came from. So the point is, you can't entirely, with our world the way it is and where people travel all over the place all the time, you can't shut down things entirely. I mean, it just... So I'm betting on the development of vaccines right now. And I'm also thinking, quite frankly, that we're going to probably have to learn to live with a little bit of COVID in our society, kind of like we live with influenza every year. I suspect that's what's going to happen.
Absolutely. Well, we of course hope for the best, but we thank you for giving us information from the front lines of this pandemic. And thank you for your time today.
You're certainly most welcome.
And we'll be right back with more. Stay with us. We are continuing our discussion with one of our local medical professionals. Joining me is Dr. Yolanda Martinez, Director of the Orange County Health Services Department. Dr. Martinez, thanks for joining us again. And I know that we are moving into Florida's phase 3 reopening. Are there concerns about that reopening in Orange County?
Well, our primary concerns would be individual behavior, what kind of decisions residents make regarding how they engage in public health activity. Certainly, the best way to do this is to continue to engage in wearing a mask when in public. Also, it is important to maintain social distancing. And as always, frequent hand washing is very important. It's very important that we take responsibility not only for ourselves, but for those of us around us, our loved ones. We're not individuals just living by ourselves. We live in a community of family, a community of friends and co-workers. So it is very important that we take personal responsibility for our actions from here on as the community continues to open.
You know, if you take a trip to any local Publix, you're starting to see masks that are slipping down below the nose, sometimes on the chin. Are we starting to experience a little pandemic fatigue, and how do we combat that?
It is possible. It is possible. You're right. When I go to Publix or other stores, I already see individuals that are not wearing a mask or maintaining good social distancing. You know, just look around. Even though we're doing very well compared to our other counties in the state, we need to keep in mind that just one slip, just one behavior could land either a loved one or a friend in a hospital. And heaven forbid, none of us wants to be responsible for being that one person that sent a loved one, a relative, to the hospital. So it's just we continue providing information. The mayor continues to give information out in the community through his press releases. The communications team, Orange TV, obviously keeps the information out in the community. Is just to keep reminding us that this has not ended yet. We are still very vulnerable, even though it might not look that way, but it is. It happens. When it happens to you, then you see the vulnerability.
We are entering the last month of hurricane season, but this is 2020 and anything can happen.
Yes.
Is it still important for us to have a plan in place?
Absolutely. It is very, very important. And this year, probably more than ever, precisely because of COVID-19. We will open shelters if necessary, and the special needs shelters is a component that's under my purview. But people need to remember that there will be limited capacity precisely because of COVID-19 and because we want to keep the population safe. So it is important for people to have a plan, to think about it, to have what they need, and to have that other plan that might include not necessarily going to a relative's house because they could put themselves in danger or put a relative in danger, maybe a hotel. So more than ever, it is important for people to have a plan this year.
Well, Dr. Martinez, thank you so much for keeping us informed from the front lines of the pandemic. We appreciate your time.
Thank you very much for having me.
And we'll be right back with more. Stay with us. There are countless organizations trying to fight the coronavirus by doing what they do best, serving the community. Susan Forbes of OneBlood is back to share an update about what they are doing to help during this pandemic. Susan, thank you so much for being with us today. And one of the questions that I have to ask you is, you were on about 6 months ago. What has changed in the operations at OneBlood since the pandemic has, we understand that we're in a pandemic and things have really changed dramatically in life?
Well, absolutely. The pandemic continues to impact our operations, over 6 months now into this pandemic. And really, our operations are indefinitely disrupted during this pandemic. And when I say that, it's because we're not able still to be able to go back to many of the traditional locations where we used to hold blood drives, such as high schools, colleges, universities, movie theaters. Those are very big blood drives for us. I mean, high schools and colleges alone account for about 20% of the blood supply. And right now, we're not able to go back to most of those locations. So that's significant for us. And it's why we continue to stress that important information to the community to make blood donation a habit. And we need that sustained donor response. It's as important today as it was in March when we started to see the rapid cancellation of blood drives when all the businesses started closing. So it really, we continue to be impacted by it. And we turn to the community and encourage them to continue to make blood donation a habit.
How is OneBlood helping to residents here in Orange County to really help them during these uncertain times during the pandemic? Is there anything special going on?
Well, really, in addition to the general blood supply, where we need the constant flow of donors coming in every day to ensure that ready blood supply, we also need convalescent plasma donors as well. So the people who have recovered from COVID-19, we need them to come in too, because they're able to donate for plasma, which is playing a very big role in the hospitals who are turning to convalescent plasma to help treat many of these patients still fighting the virus. So that is another avenue of the blood supply that we have created, a convalescent plasma supply, and then there's the general blood supply. So kind of two tracks of the blood supply taking place. In addition to that, we're testing all blood donations for the COVID-19 antibody. So every donor that comes in is going to receive a COVID-19 antibody test. To their donation will receive that. And that's providing very important health information back to the donors, letting them know if they had the virus, because they could have been asymptomatic, didn't know they had it, but we're going to be able to let them know that by doing the antibody testing. And they're able to see their results about just a few days after donating by logging into their donor portal at oneblood.org, and their information will be right there for them.
And since we don't have the traditional blood drive outlets like you mentioned, how do people give blood, and how do they contact you? You mentioned the website. Are there ways that they can set up an appointment to give blood?
Well, the big red buses are still rolling, and they are out there throughout the community every day having blood drives. So we look to the community to get creative with us and find some additional ways and locations where we can host blood drives. A great example is some homeowners associations have reached out to us wanting to have blood drives right there, basically in communities right out your back door, basically. So that's been very successful. And that's a great example of getting creative and taking the big red bus to where people are, because many people are still working remotely. So we can roll the big red bus up to homeowners associations and make it very convenient for people to come out and donate. You can go to oneblood.org to make your donation appointment. And also you can book the big red bus right there. So if you want to have a blood drive, we're ready and willing to do that. And we encourage people, now is a great time to start thinking about how can you have a blood drive in your community, because you really are needed.
And you mentioned convalescent plasma, and I want people to understand the importance of how that works to help people who are who have COVID-19 and who are trying to recover. Can you tell us about that?
But people who have had COVID-19, when they recover, they have created antibodies to the virus, and those antibodies remain in the plasma portion of their blood. So, by transfusing their plasma into a patient still fighting the virus, it has the potential of boosting that patient's immune system and helping them recover. So, they really do hold that potential key in helping many of these patients recover from the virus. And it's a therapeutic option that hospitals are turning to more and more. There aren't that many options in treating people who have COVID-19, and convalescent plasma has really moved to the forefront in being an option in treating many of these patients. And hospitals continue to order it. We continue to collect it every day throughout our service area, and we are making deliveries of convalescent plasma in addition to the general blood supply donations to hospitals on a daily basis. So it's something that's continued to be needed. As long as we are in a pandemic, there is a need for convalescent plasma donors.
Well, Susan, thank you so much, and thank you for all that OneBlood does to help our community, and for giving us all the many reasons why you need to donate blood. Thank you so much.
Thank you.
And we'll be right back with more. Stay with us. We've heard from a variety of leaders today trying to keep you informed about the coronavirus, from local government, the medical community who's on the front lines dealing with this pandemic, and organizations who continue to serve this community. And we are also here to help you keep making those healthy connections. Stay safe.